In recent years, there has been a growing awareness around developmental, behavioral, and learning challenges among children. Early intervention and holistic therapy have emerged as key factors in supporting children's overall growth and well-being. Today, we are at a pediatric therapy center that brings together multiple specialized services under one roof. The center focuses not only on therapy, but also on creating a supportive environment for children and their families, emphasizing early diagnosis, structured intervention, and emotional well-being. To understand the growing importance of these therapies, we are joined by Dr. Shweta Wadhwa, a pediatric occupational therapist who works closely with children across developmental, behavioral, and communication spectrums. Hello, Dr. Shweta Wadhwa. Thank you for speaking with Hindustan Times. To begin with, could you please tell our readers a little about yourself, your professional journey, and what inspired you to work in the field of pediatric therapy and early intervention?
Thank you so much. So I started working as a pediatric occupational therapist, and when I was working with the kids in the early years, where I realized कि जब हम बच्चों के साथ पहले अगर काम कर लेंगे, so it would have been a better journey for them. जितना जल्दी हम प्रॉब्लम को एड्रेस करके उनके साथ उनकी प्रॉब्लम्स को रिजॉल्व करने में काम करेंगे, it is always better to go ahead with early intervention. So precaution is the first step. So that is how I decided to work more with the early intervention.
Thank you, Dr. Shweta, for sharing your journey with us. To begin our conversation, you work across multiple areas such as occupational therapy, speech therapy, special education, ABA, play therapy, counseling, and handwriting intervention. When we talk about a pediatric therapy center like yours, what does a multidisciplinary approach really mean in present?
When a child enters our door, it really means that we should look the child as a whole. If a parent is coming to us with just one concern as a speech delay, I do not have to see that child कि उसका सिर्फ speech नहीं आ रहा है. I have to look that what are the underlying factors जिसकी वजह से बच्चा बोल नहीं पा रहा है. Whether it is that the child is not really getting that enough time from the parents. And when I talk about a pediatric center which has a multidisciplinary approach, which means that we have occupational therapists, speech therapists, special educator, that means that my team is completely well coordinated. So हम सबको मिल करके उसकी इस गोल को अचीव करने में काम करना है.
So essentially the focus is not just on one challenge but on understanding the child as a whole.
Correct.
Based on your experience, what are the most common concerns that parents approach you with today?
A lot of concerns like speech delays, attention issues, hyperactivity, behavioral concerns are coming up. The reasons, the pattern behind all these problems becoming so often, maybe one, the most important culprit is the screen time. The overusage of screen is something which is too much. We have less of the outdoor activities and too much indoor activities are going on. Third, the sensory exposure that we used to get in our times when you used to go to the park and play and just get all that exposure, that has almost reduced these days.
So many parents often wonder whether these issues are temporary or something that's need professional attention. At what point should parents stop waiting and consider an assessment or therapy? And how crucial is early identification when it comes to speech delays, behavioral concerns, or learning difficulties?
The right time will not ring a bell and tell you that this is the right time. As soon as you know and you notice any single concern with your child, bang on. That is the time when you should start realizing, is everything right or do I need to take certain advice? Advice is very valuable actually. The assessment means that you are trying to be preventive towards any of the concerns of your child before they become big.
That reassurance is very important, especially for families who may be feeling overwhelmed. So as we conclude, I would like to ask you something directly for parents. What message would you like to share with parents who may be worried about their child's development but are unsure about taking the first step?
Seeking therapy is not just a weakness. It is one of the strongest decisions you can make for your child.
Thank you, Dr. Shweta, for sharing your insights with Hindustan Times. Your perspective reinforces the importance of early intervention, awareness, and a supportive environment in helping children reach their full potential.